There is a hospital room. White walls. Sterile air that tastes like fear and antiseptic. A newborn lies in a bassinet, wrapped in a pale yellow blanket. The machines around her beep in rhythmic succession, steady, methodical, the only sound in the world. The mother watches from her bed. She's waiting for the cry. Every mother waits for the cry. It's the first proof that your child is alive, that they can breathe, that they exist in a way the world can hear. But the newborn doesn't cry. Minutes pass. The nurse checks the APGAR score. 9 out of 10. Healthy. Perfect, even. No distress signals. No struggle. Just silence. The kind of silence that should be impossible in a delivery room. The kind of silence that makes your stomach drop. The mother's eyes never leave the child. She whispers something, a prayer, maybe, or a plea. The words are lost in the hum of machines. And the baby, with her dark eyes open and aware, gazes back without making a sound. This is not the beginning of the story. This is what happens at the end. The Grimshaw family has lived in the same valley for 147 years. The stone house sits at the edge of a town called Millbrook, a place where nobody ever leaves and nobody new ever stays long. The roads leading in are narrow and winding. The roads leading out are the same. Generational silence. That's what the doctors called it, once. A rare genetic anomaly. A neurological condition that affects the vocal cords from birth. Something that exists in the medical literature as a footnote, a curiosity. A statistical impossibility that somehow became routine in the Grimshaw family. For 9 generations, every child born into the Grimshaw bloodline has entered the world without sound. Not a whimper. Not a gasp. Not the desperate, raw cry that signals a child's arrival into pain and consciousness. The other children, the ones born to regular people in regular families, they announce themselves violently. Their cries fill hospitals and homes. They demand to be heard. But Grimshaw children? They open their eyes in absolute stillness, as if they are listening to something the rest of us cannot hear. As if silence is their native language. The parents grew to expect it. The grandparents accepted it. And by the time the 5th generation was born in silence, the family had stopped questioning why their children sounded like ghosts at birth. They had begun to treat it as normal. But normal is a dangerous word in a family where nothing else is. Eleanor Grimshaw was 23 years old when she gave birth to her daughter. It was 2019. The hospital room was the same one her mother had used. The same one her grandmother had used. The sterile smell of fluorescent-lit birth wards and latex gloves and something that might have been resignation. Eleanor knew what to expect. She'd heard the stories her entire life, each retelling more matter-of-fact than the last. Born in silence. All the Grimshaw children were. It was simply how it happened. The labor was standard. 12 hours. Difficult but not impossible. The kind of birth that fills you with exhaustion and something close to ecstasy when it's finally over. The doctor placed the newborn on Eleanor's chest, still wet and trembling from the violence of arrival. And then it happened. The cry came out. But it wasn't a sound like other cries. There was a thickness to it. A wetness. As if something inside the child had broken. The cry was deep and guttural, like something drowning. And there was color to it. That's what Eleanor would later struggle to explain. A sound that had a color. She saw the blood before she heard it. Small flecks on the white blanket. Darker streaks appearing with each cry. The sound continued, raw and wrong, and Eleanor watched in frozen horror as crimson mixed with amniotic fluid and the ordinary pink of a newborn's skin. The cry lasted 11 seconds. No one present could explain why that detail mattered. But everyone would remember it. 11 seconds. 11 seconds of a sound that shouldn't have been possible. 11 seconds that broke something in the hospital that day. When the sound stopped, the silence that followed felt even heavier than before. Millbrook is a small town, and small towns have perfect memories. By evening, everyone knew. The waitress at the diner mentioned it to a customer. The customer mentioned it to his wife. The wife posted it to the neighborhood group chat. By morning, the Grimshaw birth had transformed into 100 different stories, each stranger than the last. The child cried blood, was what most people said. Others added details they hadn't witnessed. The doctors couldn't stop it. The mother screamed. They had to quarantine the room. The police came. The father collapsed. None of these things had actually happened. But repetition has a way of making lies feel like memory. At the town library, an elderly woman named Margaret, who had lived through Grimshaw births before, began to recall things out loud. She spoke of Eleanor's grandmother, born in 1952. How there was something odd about that birth. Not recorded officially, but odd. She mentioned Eleanor's mother, born in 1978, and how the midwife had seemed unusually tense that day. There was always something, Margaret said to the librarian. With Grimshaw babies. You could feel it. What was it? No one could quite articulate. But people nodded. People remembered. Older residents dug through their mental files and began to construct a narrative that had perhaps always been there, waiting to be recognized. The Grimshaw children, all 9 generations of them, they were born in unnatural silence. And there had always been whispers about what that meant. What kind of family could produce children who didn't cry? What kind of bloodline could swallow sound itself? The birth of Eleanor's daughter didn't answer these questions. It only made them louder. Eleanor Grimshaw gave her first and only interview to a local journalist named David Chen 3 weeks after the birth. It's the only direct account of what the family believed was happening. The silence, Eleanor said, sitting in her living room with her daughter, who was, by every medical measure, completely normal. It's not an illness. It never was. Our family has known this for generations, but we stopped talking about it. Because no one wants to hear the truth if it doesn't fit into medicine. David asked her what the truth was. Protection, she said. The silence is protection. 4 generations, every child born to the Grimshaw family was protected from sound. From noise. From the world reaching in. They experienced their first moments in absolute peace. Some people would call that a miracle. But then Eleanor's daughter had cried. The family interpreted this, and this is where it becomes difficult to follow their logic, as a breaking of the protection. A rupture. Something had changed in the bloodline. Something had fractured. When she cried, Eleanor said, her voice wavering slightly, it wasn't just sound. It was something leaving her. Something that was supposed to stay inside. It mixed with blood because something inside her was breaking open. She wouldn't elaborate on what was leaving the child. When pressed, she simply repeated, the silence was supposed to keep her safe. From knowing certain things. And now she knows them. The interview was published in a regional newspaper. It was read by exactly 1,847 people. Most dismissed it as the concerning ramblings of a woman processing trauma through mysticism. But some read between the lines and felt something deeper, a hint of genuine terror beneath Eleanor's measured words. The child, now named Iris, remained completely healthy. Every test came back normal. The hospital had run extensive panels. There was no bleeding disorder. No medical explanation for the blood in her cry. The doctors could offer no answers. And the Grimshaw family offered only riddles. Sarah Williams had worked in pediatrics for 28 years. She had delivered over 3,000 babies. She had seen conditions that were rare. Conditions that were truly rare. Conditions that made her question her understanding of human biology. But she had never seen anything like what happened at Eleanor Grimshaw's birth. The blood work was negative. No clotting disorder. No bleeding condition. No genetic markers for any known hemolytic disease. The infant had normal hemoglobin levels. Normal red blood cell counts. No trace of anything that would explain why blood appeared during the cry. It's impossible, Dr. Williams said to her colleague, Dr. James Park. And yet it happened. They pulled the medical records for Eleanor's mother's birth. There was nothing unusual documented. But the notes, written by a different doctor, decades ago, had a tone to them. A hesitation. Phrases like unusual presentation and atypical vital signs for delivery. They requested files from the Grimshaw births going back further. What they discovered was a pattern hidden in the language of medical documentation. Phrases that appeared again and again, non-vocal delivery, complete absence of distress signals, infant comportment unusual for age. In older records, there were actually annotations, brief marginal notes from physicians who seemed to be struggling to describe something they didn't understand. One note from 1952 read, "Child born in absolute silence. Mother claims this is normal for family. Concerning. Requires psychological evaluation." The evaluation was never done. "This has been happening," Dr. Park said slowly, reviewing the pattern, "for at least 70 years. And we documented it. And then we ignored it." They brought their findings to the hospital board. The board's response was cautious. They couldn't study a genetic condition without the family's consent and participation. They couldn't force medical intervention on healthy infants. And by all the measurable standards, the ones that fit into the established framework of medical knowledge, there was nothing wrong. The Grimshaw family declined further testing. And the doctors were left with an unsolved mystery, filed away in computers where no one would look, waiting for someone to ask the right question. A year after Iris was born, Eleanor had a second child. The second child was born in silence. No cry. No cry at all. Just the perfect, unnatural quiet that had marked every other Grimshaw birth. The doctors and nurses found themselves almost relieved. This was expected. This was precedent. This was something that fit into the family's pattern. But the pattern had been broken. The family realized something terrible. When Iris had cried, something had fundamentally changed. The protection had failed. And now, with the birth of Iris's sibling, they understood the implication. The silence, whatever it had been, was gone. No future Grimshaw child would be born in that protective quiet. The bloodline had been ruptured, and the rupture was permanent. The next generation would enter the world like every other child, vulnerable and vocal and exposed to all the noise and pain and chaos that sound carries. But there was something else that Eleanor and her family wouldn't discuss publicly. Something they kept among themselves, whispered late at night when no one outside could hear. When Iris turned 6 months old, she started having nightmares. Screaming nightmares, full of terror and desperation. The kind of nightmares that made her parents wonder what a 6-month-old could possibly have experienced to justify such fear. When Iris turned 1 year old, she had what doctors would classify as a developmental delay. Not severe, but noticeable. She was slower to speak than other children. Slower to engage. When she finally did speak, her first word was a single sound, quiet. She kept repeating it. Quiet. 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 As if she was mourning something. The child who had broken the silence, who had cried blood and shattered the family's ancient protection, seemed to be carrying the weight of that shattering. As if, in breaking the silence, she had broken something inside herself. And the family understood what had perhaps always been the truth: the silence wasn't a gift. It was a curse that they had learned to live with. And Iris was the first one to feel the full weight of it. Eleanor Grimshaw hasn't given an interview since the one with David Chen. She's requested privacy. The family has requested privacy. And Millbrook, as small towns do, has gradually moved on to other gossip, other mysteries, other dark things to whisper about. But the Grimshaw house is still there. And inside it, something has changed. Iris is now 7 years old. She speaks very little. When she does, her voice is quiet, quieter than other children's voices, as if she's terrified of the sound her own breath makes. She doesn't play with other children. She doesn't go to school. Eleanor homeschools her, which is her right, though neighbors find it suspicious. Those who have seen Iris describe her as haunted. They use that word specifically, haunted. She has the eyes of someone who has experienced something that changed them. Something she can't explain. Something she can't forget. Eleanor has aged visibly in those 7 years. Her hair has gone prematurely grey. She looks at her other children, the ones born in silence after the protection was broken, with a kind of desperate hope. As if she's waiting for them to show signs of what Iris carries. As if she's waiting for the curse to spread. The hospital where Iris was born has new protocols now. Documented. Official. When a Grimshaw baby is born, they run specific tests. They prepare for specific contingencies. Not because they understand what might happen, but because they've learned that understanding is sometimes impossible, and preparation is all we have. Dr. Williams still works in that hospital. She still thinks about the birth of Iris Grimshaw. She's written 3 papers about it, all rejected by medical journals for being insufficiently evidenced and speculative. She has a file on her computer called Grimshaw Unexplained. She opens it sometimes, looking for patterns, looking for answers. She's found none. The town of Millbrook has settled into a kind of uneasy acceptance. The Grimshaw family is what it is. They are marked. They are different. And whatever protected them before is now broken, and there's nothing anyone can do about it. In the Grimshaw house, late at night, you might hear Iris crying quietly in her sleep. And her parents might lie awake, listening to that sound, wondering if it's normal grief or something deeper. Something that tastes like blood. Something that remembers when their family knew how to be silent. No one has ever found a medical explanation for what happened. No one has ever definitively proven that the blood in Iris's cry was actually blood. The samples taken that day were never properly analyzed. The hospital's procedures didn't account for such an unusual scenario. By the time anyone thought to preserve the evidence, it was gone. The family won't discuss it anymore. Eleanor stopped responding to journalists 5 years ago. The last anyone heard from her was a brief statement: "My family has asked for privacy. We do not wish to be part of your narrative." But the question remains. What was the silence protecting? And more disturbing still, what will happen to the children born after the silence was broken? The ones born into a world without that ancient, inexplicable protection? Iris shows signs of psychological disturbance that no therapy seems to alleviate. She speaks of remembering things, but she's too young to have lived them. She describes dreams about places she's never been. She draws pictures of symbols she's never been taught. Is she carrying something that was removed from the bloodline? Is she bearing the weight of generations of protected forgetting? And if the silence was protecting the Grimshaw children from something, if that's what Eleanor meant when she spoke of protection, then what will happen when all the children are born into the noise? When none of them have the shield of that ancient, unnatural quiet? The Grimshaw house still stands in Millbrook. The family still lives there, mostly invisible, mostly quiet. And sometimes, on nights when the wind is right and the town is sleeping, people report hearing something coming from that direction. A child crying. Not the normal cry of a child in distress. But something older. Something that sounds less like sound and more like something breaking. The sound of silence itself, perhaps. Shattering into pieces. Falling down forever. And no one knows what will catch it when it lands.